We're back now with a question from one of you for Dr. Darien. This one is from Thomas M. How is food impaction diagnosed and treated?
Yeah, this is a term, food impaction, just simply getting the food stuck where it doesn't belong. When we swallow, there's a whole series of processes that goes on that allows food to get from our mouth to our stomach, and that travels through the food pipe or the esophagus. And in some cases, if you don't chew enough, if you have a large piece of meat, it can get stuck. And that can be a very, very scary situation that patients often come into the emergency room for. So what do you do if that happens? If you feel like food is stuck, number one, check if you can breathe. If you cannot breathe, that obviously is a medical emergency. You want to get to a hospital, get help as soon as possible. If you feel like you can still breathe, there's some things you can do, like drinking a carbonated beverage can sometimes relax and allow food to pass. But if you're having pain, if you're having difficulty swallowing, these are all reasons to get yourself to the emergency room. There are different things that we do when patients come in with this problem, but it's more common than you think. And a lot of it is tied to not chewing your food, but also some people might have a diagnosis like a stricture or a narrowing of their esophagus that they might not know about that increases their risk.
The doctor's prescription for wellness.
Protein. We're talking about muscles, so maintaining your muscle growth. We talk so much about building that muscle growth, but then many people ask, well, when we get there, how do we keep it? So today's prescription for wellness are on some things you can do to maintain that muscle after you build it up. The first thing you want to start, obviously we always talk about this, in your kitchen. It really is important to make sure that you're getting enough protein. An estimated half of us don't get that relative, or excuse me, the minimum amount of protein that we need. If you're over the age of 40, also remembering you need at least 1 gram per kilogram. Multiplying your weight by 2.2 will help get you there. Also, resistance training. This is really important. If you're in the gym and you're finding that your muscles are not getting bigger or you're not getting to your goals, increase the weight and lower the amount of repetitions. We always talk about 12 to 15 repetitions, but if you increase that weight and you lower the repetition, you're going to help get your muscles to failure and hopefully get your muscles to grow. And then practice moving your body faster. That doesn't just include adding cardio to your workouts, but also just in general, your everyday activity, going up a flight of stairs, sitting up, getting up from a chair, things like that. You want to make sure to move your body just as much as you do in the gym as you do outside the gym. And sleep. And sleep. I know, DeMarco, we're still trying to help him understand where the stairwell is in the studio.
I will wait for the elevator for 2 hours.
I'm just sitting here.
Thank you. No judgment, right, Eva? And folks, we would love to hear from you, so please hit us up on Instagram with all of your medical questions for my friend, Dr. Darien at ABCGMA3.